Austin. He formerly was with Kansas Policy Institute. Now he's an independent researcher. His overall theme was a look at COVID, the COVID shutdown, the mandates, and really how many people did. The media, in my opinion, they exaggerate everything. But I really think they've exaggerated a little bit, or maybe a lot, the number of people that died from COVID. And so Michael's done some looking into mortality statistics for Kansas, and he's going to talk about that. We're going to have him about 15 minutes or so. Michael Austin, you're up.
All right, can everyone hear me well?
Yes.
Great. Good evening. My name is Michael Austin. I was formerly of the Kansas Policy Institute, but like Chris said, I am now my own economic researcher. I can, of course, tell you maybe a couple of, occupations that I've had, but it doesn't really tell you, what I believe in or what drives me. So if you'll allow me a little bit, I'd love to tell you a little bit story about where I come from. I am a first generation Kansan, second generation American. My family comes from Great Britain and the Caribbean, and I was actually born in New York. And I was born to a family that unfortunately lived at or below the poverty line. I vividly remember being a child and my mom having to sort through welfare stamps so that we could understand what things we could purchase and what things we could not. Now, living in New York City, my parents, of course, instilled in me a belief that your only job is to go to school and get a good education. And by golly, of course, I tried the best that I could. But what I may not have known at the time was that living in New York was very stressful and very hard on my parents. We weren't encouraged to save. There were a lot of rules, very complicated rules, and we never felt that we could even get by. And it even started to affect, my focus. Despite my education, I got into gifted programs, gifted middle schools, gifted elementary schools. The high school that I was slated to go to, it was called South Shore High School. It was busted for drugs, on average, 4 times a year, just before I would have entered it. Constant police presence, constant gang presence. At that point, my mother said to herself, if there was any way that we could move out of New York City, she would take it in a heartbeat. Lo and behold, we got an opportunity. We were given a very, very generous gift of charity to leave New York City and come to Kansas. And as great as that offer was, we couldn't even afford the move. My mom had to sacrifice, she had to save, she sold everything that we owned, except for the clothes in our closets, just so that we could afford the trip to come here. Which makes sense, because when I was 10 years old, I always wondered how we got everything to fit into one minivan before I could move. So it was those 3 things, right? It was sacrificing. It was hard work, it was saving your money. Those 3 principles, or actually we add a little 4th one, charity, those 4 principles saved my life and turned it around. And what I have done for my entire professional career has tried to have government promote those same 4 principles to you all as you guys have done for me and my family. So with that said, let's begin our discussion about COVID-19 and health statistics. Our conversation today, what I would love to cover is something we call the law of trade-offs. Then we'll go into excess deaths, we'll summarize a little bit, and then we'll go into frequently asked questions. And because I'm only speaking about 15 minutes, we may not get through the entire presentation. However, if you give Chris your email, I've already sent him a copy of my presentation today, so you can easily see it on your own time. And then, of course, you'll have my email address, and you can ask me any questions, Sam. All right? Okay, if there is one thing I would love for you to take from this presentation, it would be this quote by famed economist Thomas Sowell. He says, trade-offs have been with us ever since the late unpleasantness in the Garden of Eden. As an economist, what this means is that every decision you make has a cost. Now, I'm not just talking about monetary costs, I'm talking about trade-offs, right? For example, the decision for you all to come here and have a burger or have steak is a price that you pay. Perhaps you could have been at home watching Wheel of Fortune. Perhaps you could have been at home, enjoying this lovely weather, drinking a beer. You paid that. You gave that up so that you could come here and listen to me speak. Thank you. And while for each individual person it may be a small or trivial matter, when it comes to larger decisions that have like a one-size-fits-all effect, it may not be so funny. Okay, fine, I do have a funny story. Let's see here. Back during the colonial rule of India, the city of Delhi had a massive cobra problem. Venomous snakes were completely littering the streets. People were getting bitten, people were getting sick. Obviously, no one was having a good time. The city government had a great idea to combat cobras in the streets. They decided to put out a bounty. They would encourage people to catch these snakes, send it into the government, receive some income for it, and people will get paid, and there are fewer snakes on the street. And once they put that bounty into place, yes, the cobra population drastically fell. The end. No, it was not the end. Eventually, people realized that instead of catching the snakes and just sending it to the government, they can catch the snakes, take it home, breed them, and then continue to hand the snakes into the government for steady income. Eventually, the government realized they were paying the same amount of money in a bounty every single year, but when they went outside, they couldn't see any more snakes in the street. They realized people were trying to gyp them, right, or fool the government. So naturally, what did the government decide to do? End the bounty. But now you had all of these families in the city that had cobras in their home, breeding them, having multitudes to multitudes of cobras that was worth a bounty, and now it's worth nothing. Guess what all those families did? They put those snakes back out into the street. And because of that bounty, right, the city of Delhi had more venomous cobras in the streets after the bounty than before. Human beings react to every rule, every regulation, and every order. And sometimes, most of the times, it's in a way that the planners never expected. When we're talking about COVID, for example, there were many ways that we could fight COVID mitigation. One of those was lockdowns, school closures, stay-at-home orders, outpatient clinic closures. Another one was mass promotion, ad campaigns, increasing hand sanitizer production, making it really flexible for businesses and workers to work or buy products. There's a reason I grouped these two COVID mitigation efforts this way. One of them has a high economic trade-off. The other one has a low one. Which one did government largely choose? The high economic trade-off, right? In fighting COVID, they picked a method that whether or not it, slowed down the spread of COVID is up to you, but it most certainly had drastic economic consequences. Closing businesses based on a political process instead of letting each small business owner choose which to pull back on, that had a consequence. Closing schools to do fully remote learning, that meant thousands of parents had to choose between going to work and staying home to supervise their children. And guess what? Many parents chose to stay home, which meant lost jobs, closed businesses, and for the children, it meant a learning loss. I don't know if you guys knew this. Back in April of 2020, a couple 300 to 400 doctors sent a letter to President Trump. This was when the entire country, for the most part, was just in some sort of state-mandated lockdown. Have you heard about this letter that was sent to the president? Okay. In this letter, these doctors warned President Trump to not let these lockdowns persist. Fighting COVID is one thing, but how we do it is just as important. Here's what they said in their letter. They said, President Trump, we're noticing suicide hotline calls are spiking 600%. We're noticing that people are missing their cancer screenings. We noticed that liquor sales are up 300 to 600%. Cigarette sales are higher. Family relationships have become frayed. Child checkups have been missed. Here's another trade-off that was even in the news. Here's a report from The Guardian in December 2019. The title says, thousands of patients die waiting for beds in hospital. Study. In April 2020, the Utah Southwestern Medical Center said stroke sufferers are silent victims of COVID-19. They're not going to the hospital. NPR in May said COVID-19 fears may be causing people to ignore medical emergencies. Unfortunately, these trade-offs are getting much more tragic. Victoria Advocate in June 2020 said, experts are saying, please do not delay emergency care during the pandemic. Denver Post in November 2020, just a couple of months ago, said more Coloradans are dying from Alzheimer's disease during the pandemic as social isolation takes its toll. Fighting COVID is one thing, but you cannot ignore that these policies right, if not checked or if ignored, can have drastic economic consequences and even result in a loss of life. Excess deaths. This brings us to our research today. Excess deaths, as defined by the U.S. Census Bureau, is the difference between actual death counts and expected death counts. The reason we want to look at excess deaths is that it will show, of course, if there's any abnormality or what is the effect on American mortality based off of some significant event. Obviously, when we think about excess deaths, you have an idea that COVID is pretty much the abnormality that we're seeing into 2021. So what I decided to do is I wanted to look at actual 2020 deaths and compare it with an expectation. And in this case, the expectation was the average mortalities in the prior 5 years, so 2015 to 2019. As I said before, all COVID deaths should be considered as an excess death. It's an extra death, a death that unfortunately was not expected or not accounted for in the prior data. But can there be non-COVID related excess deaths? And unfortunately, the answer is yes. Okay, what we're gonna see here, I have broken down excess deaths. These are these extra deaths by age group. I believe there is, oh yes, you can see it here, 85 years and older, 75 to 84 years, 65 to 74, 45 to 64, 25 to 44, and those under 25 years of age. If it's positive, that means it was more deaths than what was expected. And I broke it up into COVID deaths and non-COVID deaths. Let's look at the first age group, those who are over 85. What would you expect to see? More blue, more red? You would expect to see more blue, more COVID deaths, right? Obviously, would be much more susceptible for individuals who are over 85 years of age. And yes, here you have it. So when you compare 2020 deaths to the prior 5 years for those over 85, you'll see that there's about 1,300 extra deaths that were solely tied to COVID. 2 that weren't tied to COVID at all. Maybe that's somewhat expected. Let's go down to the other age group. When we look at those 75 to 84, what did you notice? That red bar got a little bigger, which means the extra deaths that we saw in 2020 were not COVID related. For that particular group, it was 330 non-COVID deaths and about 1,000 COVID. What do you think is going to happen as I keep looking at younger age groups of Kansans? Look at that, 65 to 74 years of age. It almost looks split. 728 extra deaths weren't tied to COVID-19 at all. And yet about 616 deaths were. That's a complete flip. In other words, according to that information, you are just as likely to pass away from a non-COVID related death than from a COVID-19 reaction. And in fact, when we look at our prior data, when you think about those trade-offs, it's likely that those non-COVID deaths are probably a reaction to COVID itself, that increased social isolation or the increased domestic abuse that we see when either wives or children are stuck with an abusive partner at home, or the increased depression, suicides, murder, all the worst things that you can think of because of the government as well as media societal reaction to COVID. When we look at 45 to 64, it's also a little split. Now, we go to those Kansans 25 to 44. Now it's decidedly a non-COVID death. These are extra deaths, right? So for some reason, we can't pinpoint why this is so much bigger than the prior 5 years. Now we're gonna look at those under 25. 195 non-COVID deaths, 0 COVID mortalities. Now this might be a little confusing to see because you might say, well, 195 for those under 25 years of age isn't that bad. Let's put it in a different scale. Here, it's the same excess deaths, but it's going to be as a percent of the 5-year average. So for example, those Kansans 85 years and older, the COVID extra deaths are only about 15% of what we've seen in the prior 5 years. When we go to 75 to 84, the COVID deaths are only 17% of what we've seen in the past 5 years. 13.3% of COVID deaths for those 65 to 74. Here's 45 to 64. Here's 25 to 44. non-COVID deaths for those Kansans aged 25 to 44 represent about 26% of the average mortality in the prior 5 years. Let's see the youngest group. That 195 non-COVID deaths that I showed you in that prior chart represents about 55% of average mortality in the past 5 years. It may be a small number, but compared to the trends of mortality for that age group, it is decidedly bigger, significantly larger. So as I said, in summary, human beings react to every rule, regulation, and order imposed, and those reactions result in outcomes that can be quite different than what lawmakers and public officials expect. And for certain age groups, there's a higher chance of dying from a non-COVID-19 reason, perhaps tied to a COVID-19 response, than from COVID-19 itself. And so the effects of COVID-19 government policy doesn't just go away. The Kansas legislature did a great job in limiting the governor and her ability to implement these types of mandates and lockdowns. And as great as those policies are, it doesn't mean that the effects go away, right? This is a loss of Kansas lives that we have here, possibly related to COVID, possibly related to the reaction to COVID, and those you can't get back. Now, Chris, I plan to end it here because you said 15 minutes, but if there are questions, I have prepared a couple of FAQs, such as, did more Kansans pass away in 2020 versus 2019? What is the trends between COVID-19 and the flu? And then there was probably one more, and I can't remember, but this presentation, of course, is available to you digital if you give Chris your email. Okay. Any questions?
Do you have some slides for the FAQs?
Yes, they're already here. So I was just planning on stopping here. Probably like 5, 6 more.
Let's have them.
Okay.
Is that okay with you?
Is that all right with everybody? We'll keep going.
Yeah, 10 more minutes.
Thank you. And I apologize in advance. This is obviously, I love to make people laugh and whatnot, but unfortunately this is serious stuff. But because it's serious, we deserve to give it the appropriate attention it deserves. So here's a popular question. Did more Kansans die in 2020 than 2019 and prior years? The answer is yes. So here in this chart, I wrote down those same age groups going from 2015 to 2020. And then in this last, row, I looked up the 2019 to 2020 change, and you see the percents. In other words, the mortalities for all these age groups is positive. We did see more individuals die in 2020 than any of the prior years. But because of our prior conversation between COVID-19 and non-COVID, you can't necessarily attribute it to COVID-19. But yes, more people did pass away. Another question, where's the flu? So season to date, flu hospitalizations are down 99%. Influenza-like illness continues to track lower. If you're looking at this chart, it's the triangle bars. That's the 2021 season, and it's consistently below almost every other year. In Sweden, for example, they don't have any COVID mitigation. Remember, they didn't do any lockdowns, or they're pretty lax on masks. They don't have the flu either. Brazil also has lax COVID mitigation. Not as lax as Sweden, but the president of Brazil basically told everybody to disregard their public health agency. Maybe we should take some cues. But they don't have the flu either. It's not a mitigation issue, right? People say, well, it's because people are wearing their masks. No, that's not it at all, right? What we're doing to fight COVID clearly isn't working. We still had really high peaks of COVID. We had falls in COVID, and we were wearing our masks the whole time. And then we have countries that aren't doing anything, and they're also not seeing the flu. So that doesn't explain where the flu has gone. These two areas, Western Africa and East Asia, I included them here because according to the World Health Organization, they don't really have much in terms of COVID-19 cases. It's pretty clear. What do you think has happened to the flu in those areas of the world? They're present. You don't need to see the exact numbers, but the fact that you can see bars up there basically tells you that the flu is present in areas where COVID-19 is not. This chart is kind of involved. All I want you to see is what's here in the red circle. The number of tests that have been done to find the flu is higher than what we've seen in the average 5 years. It's not that we're mislabeling it, and it's not that we're not looking for it. We're testing just as much or more than we've done in the prior 5 years. But look at that arrow. When we conduct those tests, the amount that's coming back positive for the flu is significantly lower. From weeks 40 to 15, the positivity rate is far below 0.5%. The latest research suggests COVID-19 is outperforming other respiratory viruses. That's the best way that I could explain it without confusing you, right? Let's see this way. When the swine flu eventually dissipated, the research out there, and I think one came from the Lancet study in 2020, it talked about how if one respiratory virus can block infection with another through a stimulation of antiviral defenses in the airway mucosa. In other words, when you're infected with a novel virus, it keeps out other viruses of a similar make and model. So if you look at not just the flu, but other COVID viruses, other rhinoviruses, they are also all depressed. And the latest research is saying that perhaps COVID-19, because it is novel, it's keeping other respiratory viruses at bay. The PNAS also found something very similar. You can read that later. And Pub Medical Central also found increasing evidence that this is some sort of viral interference COVID-19 is having with other respiratory viruses. And then that's it. Any questions? Yes, sir.
So you're basically saying we've been hoodwinked.
In which way? Because there are a lot.
I won't go down there. Sorry.
So do you believe that the virus and the flu are a little bit one and the same, maybe?
No, I don't want to say that.
Okay.
First preface, I'm not a doctor. I just know how to read studies, right? And what I always try to do is just follow the facts. Right now, this thought process about viral interference, it is not a fact, right? It is just a theory that people had, scientific method, would you believe that, where they have an idea and they test it and they look to see whether that was prevalent in our history, and if so, it'll carry on as a theory until it is tested. So right now, viral interference is the theory. Maybe we'll have to get some more research to know whether it's legitimized or not. Any other questions?
I just want to make a statement, and it might lead to a question. I read something, I can't remember the source, where C19 is a variant of the flu. And can you address that at all? I mean, it sounds like you can kind of lead to that, but I read somewhere, I can't remember the source, and there's so much stuff, that C19 is actually a variant of the flu. And that's why maybe flu has disappeared, because it's now a variant of that.
I have not heard that.
Let's see if I can find that.
But yes, please let me know.
They're both viruses.
They're both respiratory viruses, that is
COVID is a
true.
virus and the flu is a virus.
But once again, as I'll say again, I'm not a doctor, right? And that'll take, someone who wants to study that scientific research and the makeup of the biological features of COVID-19 versus the flu to answer that question. But I haven't read something of that sort yet. Any other questions? Yes, sir.
I was just gonna say thank you for laying that out in a simplistic fashion and just the facts, things that we don't normally get in our media today. And then, in your opinion, just from the data that you've analyzed, what have we done right? What have we done wrong in the control of COVID?
That's a great question. Next question. I'm kidding. I think one of the biggest mistakes that we've made is not understanding that COVID cases moving through an area isn't tied to mandates, isn't tied to restrictions, isn't tied to some sort of non-medical intervention. It kind of has its own nature. I do another presentation about COVID where you can look at the United States and you can see how COVID has moved through the country. And it didn't matter whether you were California still in a lockdown, whether you were Michigan doing, mandates after mandates after mandates, or whether you were Florida who did absolutely nothing. When COVID entered, the general region, cases all rose at the same time, peaked at the same time, fell at the same time, right? Nature was more powerful than mandates. And I wish that we had all, well, some of us already did, but I wish that those that we had elected into office, right, would have been a lot slower to jump to, taking away our freedoms and not giving us some common decency and courtesy to handle the issue ourselves.
Michael, is there anybody else in Kansas? So you're one of the few guys that's actually done, scientific or good research on COVID and whether or not the death count is accurate or whether or not some of the people that maybe died from flu got labeled. You're the only guy that I know that's been doing this type of research. Do you know of anybody else in our state that is, shall we say, a bit skeptical, but maybe also doing some research in this area?
Senator Mike Thompson is most certainly skeptical. In fact, he had given me some information to look into regarding, the factors behind COVID-19 deaths. It's a big file. I haven't gone through all of it yet. But he is one, I can say for sure. My old employer, the Kansas Policy Institute, we were usually an education and fiscal policy research hub, and COVID kind of got dropped into our laps because, the media was just relentless with a narrative that unfortunately was easily disproven. So Dave Traubert will probably be another one. But beyond that, no, there are not a lot of nerds in Kansas. So, be grateful.
You stand alone.
All right. Thank you very much,
Anybody
everyone.
else have a question for Michael?
Excellent,
So,
excellent.
All right.